Welcome to the Dusty Muffins, where menopause meets sisterhood and strength. We're three menopause specialists coming together to laugh, share, and empower you through the wild ride of menopause and perimenopause. Whether you're curious, confused, or just looking for real talk, you're in the right place. We're here to answer your burning questions, educate, and advocate, all with a dash of humour and a lot of heart. So pull up a chair and join the conversation. Before we dive in, please remember, while we're doctors, we're not your doctors. This podcast is for educational purposes only and is not a substitute for medical advice. We encourage you to partner with your own medical clinician to address your unique health needs. This is the Dusty Muffins.
I am Dr. Rebbecca Hertel. I'm a board-certified osteopathic family medicine physician and a Menopause Society certified practitioner. I have a private telemedicine practice, and I see patients in several different states.
I am Dr. Aoife O'Sullivan, a board-certified family physician and Menopause Society certified practitioner, and I see patients through my telemedicine practice here in Oregon and Washington.
I'm Dr. Kress, a board-certified women's health nurse practitioner and menopause certified practitioner, and I see patients via telemedicine in several states as well.
Welcome back to the Dusty Muffins, where three menopause specialists break down the science, share the laughs, and get real about midlife health.
Today, we're talking about something that affects over half of postmenopausal women, but hardly gets talked about at all: genitourinary syndrome of menopause, or GSM.
Yep, that's the medical name for a cluster of symptoms women experience in the vagina, the vulva, the bladder, and the urinary tract after estrogen levels drop. Let's bust myths, talk treatment, and reclaim sexual and urinary health. Yo, what's up, everybody?
Once we get over our fit of the giggles, we all had a fit of the giggles there.
We did. Oh, there's a bunch of blinkery going on around here. Midlife messing around. So
we have an explicit podcast. You can say mid-fuckery.
Yeah. We can say, all right, Then there's a whole lot of mid-fuckery going on around here. And we love it.
Look at you trying to get us down to G, rated G. We got explicit for a reason, sister.
Truth.
Don't you bleep us.
Nice. I think before we get into this, though, we had quite an interesting meeting yesterday, which was really cool. And yes, a bunch of us working women working on a Saturday for the greater good of all of us. Who wants to take it away?
Well, Dr. Louise Newson had a great idea to set up a Zoom meeting and sent out an invitation. And I think maybe about 20 of us joined. Mm-hmm.
Yeah.
Anyone who was free, basically. And the topic was, we're having difficulty on social media at the moment saying the word sex hormones, sex in general. But everyone, we've all been taught in our training to refer to estrogen, progesterone, testosterone as our sex hormones, which most of us do not love, right? We don't love that term because it boils it down to reproduction and sex. And that's not what these hormones are only about, right? They're so important for our brains, our heart, our bones, our skin, our pelvis, everything. So calling them sex hormones really does seem like a misnomer anyway. So we were trying to come up with an idea of something else to call it other than sex hormones.
Mm-hmm. Yeah, because, we're kind of, when people think about progesterone, estradiol, and testosterone, the other problem is that, a lot of patients get pushback of you're too young for pick a hormone, which is not true because you have a deficiency of those hormones when you are breastfeeding. We see it when you're on birth control pills. We see it with PCOS, during radiation for, breast cancer or other type of cancers. And so, it's really a lifespan hormone, and it's not just about perimenopause and menopause, although that's what we've been mostly talking about. But I think a lot of us are trying to also shift that these are lifespan hormones that the whole body, as you said, Aoife, needs.
Yep. And I think the other issue too was censorship on Instagram, right? So the other big issue is that when you use sex, you get censored in Instagram. Either you get taken down, you get blocked, or your content is not shared to new followers. And so, that's an issue because we all educate on this platform. And, when we have a medical term, we should be able to use our medical jargon, but they don't like it. So this was yet another reason to say, okay, we need to get together and come up with some different nomenclature.
Yeah.
What was some of that we tossed around, naming it something other than menopausal hormone therapy or hormone replacement therapy? We talked about neuroendocrine hormones.
Yep.
Mitochondrial hormones.
Mitochondrial hormones.
Yeah.
Yep.
The concern was that unless you're a scientist or you're really into longevity, you may not really understand what a mitochondria is or neuroendocrine.
Yep.
They're really good medical terms, but they're not for people out in the public who don't have medical training. They're not that helpful. So I think it was Dr. Shiva Gofrani, wasn't it, who suggested just use the names of the actual hormones themselves: progesterone, estrogen, testosterone, PET. So I put that up on my Instagram, and I've had 2 comments, I think, saying, but won't we get confused about, people won't get confused about whether it's for their pet or not. But we've been ordering CAT scans and PET scans on our patients our whole careers. And I've never had a patient say, wait, is that for my cat? This CAT scan that you're doing on my head, is that for a cat? I mean, no, it's not going to happen, right?
Right. Exactly. They know, and I think, it may not be perfect yet, and maybe it'll end up being changed, but I think it's a great place to start. And that's kind of where all of, everything has a place that we start, just like GSM, right? It was not the genital urinary syndrome of menopause. It was atrophic vaginitis or the atrophic vagina or the senile vagina. I mean, it had some multiple different names, I guess, which is a nice segue into our episode here, unless we have some more things that we want to talk about with this PET.
Well, I think the one other thing, if I can just add, that I think was really important that came out of the conversation was that when the hormones are declining, it's not just a phase, and it is true deficiency. Like, once your ovaries go into retirement, you're not going to restart making your hormones. Just like when your thyroid goes kaput or your pancreas goes kaput, you're not on thyroid replacement therapy, you're not on metformin or insulin for a short period of time, you're always on it. Right. And I hear so many times women are like, oh, I'm done with menopause. No, you're not done. You still don't have hormones, and you're still going to have the ramifications of not having those hormones. Even if what you mean is, it doesn't bother me, I'm not having hot flashes, it doesn't mean that it's not doing things for your lifespan, that it's not having negative effects on your lifespan.
Yep. And I like that lifespan and health span, right? For the health of women. I've always liked that versus women's health. I think that's really important too. And not just, so, and it also encompasses all things: progesterone, estrogen, testosterone, all things, all humans of all ages. And that's also important because these are important hormones, right? For us at all ages. They come into play.
Dr. Jessica Shepherd had some lovely ideas too, didn't she? To kind of expand on it a little bit more and add in neuroendocrine and stuff. Because then you could, come up, I think she had said, was it PENT, and that could be penta, and you could have a pentagram, which looks, kind of like the outline of a hormone or a molecule. I think the overall wish was to keep it as simple as possible, which I think is why it ended up being PET, right? Just nice and simple, the name of the 3 hormones, easy to remember, and you won't get your Instagram account flagged.
Yes.
And you can have them whenever you are. Was it Kelly Casperson was talking about a male who is having tremendous problems with sleep, who now is on progesterone and sleeping
Yes.
great.
Yes.
Yep.
I
Yep.
was like, oh. So,
Yeah.
I thought that was,
all three
yeah.
hormones are for everybody.
Yeah.
Yep.
He's not going to go around saying I'm on HRT, you know?
Right.
I'm
Exactly.
sure he preferred to say I'm on pet therapy or pet treatment. I'm on
Maybe
my
we have
pet.
to call it PET and not PET. Maybe that's
PET.
the PET.
Yeah.
You know what I
Oh,
mean?
yeah. Instead of like HRT, MHT, PET.
PET.
Yeah.
I like that,
Exactly.
Christine. Yes. Yes.
And
I think
that way
makes
we
sense.
get rid of the pet therapy, pet scans, pets. Everybody loves their pets.
Yeah. I think it's just a matter of us using it online and talking about it and explaining
Yep.
it. And I think it'll make sense in the end, because we can't say sex hormones anymore. So we have to say
Right.
something.
I
So that's
agree.
what it,
Yeah.
and that's what it comes down to really is, getting that stigma off, because I can see some, of listeners, followers, whatever, saying things like, okay, so now what? We've been calling it this forever. And a part of that is that it just doesn't do it justice. And so, that's kind of our point.
No, it's always been a
It's-
shit name. That doesn't
Yeah.
make it right.
Yep, exactly.
Just
'Cause at
because it's
first I
been
was like,
around for a long
gonadal.
time, it doesn't mean it's good.
Right. And I asked even my med student, like, what would you do? And then, she had said something about gonadal, neuroendocrine hormones, but then you use gonadal and that's not, like Kelly had said, it's only 20% of where they're made. So I said, oh, yeah, okay, that's true too.
And also, if I went along my block and asked everybody, do you know what gonadal means? I'm sure a lot of them would kind of hit the mark, but a lot mightn't know what that is really.
They probably think testicles. You're nasty.
Well, and listen, maybe you wouldn't be surprised, but it's amazing how many people do not know the proper anatomy. Like they don't know what scrotum is. I mean, I have to be like, it's your ball sack. And then they're like, oh, okay.
Yeah,
Just
absolutely. Yeah, you see that all the time in primary care.
Yeah. Oh, right. So when I'm asking, these men about, testicular exams and scrotal exams, they like look at me and I'm like, your balls in your ball sack.
Yeah.
I just have to like,
yeah.
Oh my gosh. See, like the slang terms make me more like giggly and like feel like whatever than just calling it by what it is.
Yes.
And I know that people go by the slang terms because calling it what it is makes them feel weird.
Yeah. And so now for my kids, I teach them both things because what I don't want, I don't want them to have their friends talking to them about their balls and they're like, what are you talking about? So we just talk about
We
it
use
all.
the word scrotum and testicle in the Hertel household.
That's right. I know. I'm usually just like, go, put the pecker away.
That's because you have so many children. Boys are always playing with things.
I know.
Lace up with Lindsay, it'd have to be gonads to the wall. Everybody.
I know, right?
That's right.
I should tell her
the
that.
wall.
We might need to change it to gonads.
Put your pet to the wall.
So how is it that we are the Dusty Muffins and have yet to talk about GSM?
I don't know.
That just seems so bizarre that we have not talked about GSM yet.
How was that not our first episode?
I feel like we talked about it like a little bit, and then, we were like, oh, we were going to go back and give it a proper.
What was our first episode? What the hell was that?
I think we started off explaining what perimenopause was, right? Like the reproductive cycle.
And then we went through the myths, I think.
Yeah.
That's
right?
Want the Dusty Muffins at your next event? We do panels, live podcasts, and talks that bring the heat, literally. Corporate, see-me, or retreats, we've got you. So hit us up at thedustymuffins333@gmail.com or DM us on Instagram at thedustymuffins.
So let's start at the beginning of this. So GSM is a newer term, genitourinary syndrome of menopause, and it's encompassing everything that could go on in the vagina and the vulva, the bladder, and the pelvic tissues in general. When you do not have your hormones in the quantity that you need them. And that could be when you're breastfeeding, when you're pregnant, after you've had a baby, if you have PMS, PMDD, if you are on the birth control pill, and that's lowering your testosterone, and you're getting these symptoms. So in so many cases, not just when you are perimenopausal or postmenopausal, right? Yeah. So they tried to come up with this term that was a more general term.
Maybe it should be genital urinary syndrome.
Oh,
Yes.
what?
Did you just see a big light bulb go?
Yeah.
The genital urinary syndrome.
Period.
Ta-da!
Of whenever it happens.
Of
And
whatever, right? Because OCP, I have a patient that way, and I actually had presented it in our little team discussion. We talked about, she actually had the genital urinary syndrome, and it had started when she had gotten her menses, and she's very young in age, and we needed to put her on birth control. And I had that discussion with her, like, I need to know if you have vulvar pain, and kind of went through the whole thing. And sure enough, ended up coming in. I had to do a Q-tip test. And I was like a kid in a candy shop. I couldn't believe how specific I pinpointed where this pain was. And put her on vaginal estrogen. She's like, because she did not want to go off the birth control pill. So I said, well, let's try just some vaginal estrogen. Let's see if we can at least do that for you. And cleared it right up. It was incredible. Like, I was just like jumping around, like so excited, but yet I was like, if no one would have ever told her, and if no one would have ever examined her vulva the way I did, you would never know. You would never know.
And we were never taught.
No, this was from Ishwish. I just, this is all from Ishwish.
But we were never taught back in the heyday that you could give estradiol vaginal cream to anybody that wasn't post-menopause, like menopausal, finished with their periods.
Right.
And, studies suggest 75% of menopausal women have GSM, but I don't know about you, but I think it's more like in my patient population, like 99.9% report
at some point, right?
Something.
Right. And it's at some point. Like, I don't know about you guys, but sometimes it's perimenopausal. That's the very first thing. And it's only the week before their period or the week of their period when their estrogen's low. Sometimes it is more of a late menopausal issue where, they don't get it until a little bit later. But yeah, I would suffice to say that it's got to be, damn near 100% at some point, if you're not on any type of PET.
Let's
therapy.
list out the symptoms that
therapy
you get during genital urinary syndrome.
Well, with less estrogen, the vaginal lining becomes thin and dry. So things feel dry, painful with intercourse.
Yeah.
Yeah, let's list off the symptoms. Let's keep going with the symptoms. And then I think it would be a good idea, Christine, actually to go into more of the underlying biology and physiology of it and why it happens.
So the symptoms, pain with intercourse and vaginal dryness.
Thinning of the vaginal mucosa.
You can have itching around the vulva and the vagina. You can have recurrent urinary tract infections. You can have the sensation where you're having a urinary tract infection, and every time you go give a sample, it's normal. You can have the symptoms where you have to pee multiple times during the day and even get up at night to pee.
Or then, I see so many women who have self-treated themselves with boric acid because they're pretty convinced that it is a yeast infection. They have itching, sometimes discharge from inside the vagina. And then when we evaluate under the microscope, there's not an infection at all. And I think all of that becomes really frustrating for women, because I'm sure you guys see in primary care, people coming in, I got a urinary tract infection, and the cultures are all negative.
Yep.
All the time.
Or or clinicians will just treat them without a culture, which don't get me started on that one. But clitoral adhesions, pain with orgasm or the inability to orgasm.
And decreased sensation in the clitoris, right? Where you're just not as sensitive anymore.
Yeah.
And then urinary leakage too, like having
Yes.
to race to go to the toilet and sometimes not making it, or coughing or sneezing, which I think a lot of women just take for granted and we put down to maybe having delivered a baby or whatnot. But that often gets much worse as well, stress incontinence.
And the other thing that I used to see all the time are caruncles, which is
Yeah.
the prolapse of the urethra. And it looks like a little red kind of bulge, or a little red, like little pebble size protrusion from the urethra. And it's just, there's not enough estrogen to support that urethra, and you have a prolapse, just like you can, have other prolapses.
Yeah.
And then the other thing that is very, very common is for women after menopause that go in for their pap smear, and they'll have an atypical pap. And so because the estrogen is so low and the cells are thin, they're dry, when the pathologist looks at it under the microscope, some of the cells look short, some of the cells look tall, some look crooked. They just don't look perfect. And so they'll call it an atypical pap, because they have two choices. It's either normal, it's not, or it's very concerning for abnormal cell development. And so then, women get really concerned because they have to come back and have their paps repeated. And so, I always tell women, even if you hate the therapies, at least use it for 2 weeks before your pap smear, so that you can have a normal pap.
Yeah. We also will see resorption of the labia minora also, right? So then that puts us at risk for recurrent UTIs. And to play off the pap. And so when a clinician is examining a vulva and vagina and cervix, those are also changes that occur, right? They're pale. They're what we call friable, meaning just very easy to bleed. It's tender to even be able to put a speculum in, if you can get a speculum in. You get stenosis, or narrowing of that vaginal introitus or entrance.
And that urethra, when you get that prolapse, because those cells that line the urethra are the same cells that are inside the bladder, now you have a situation where even something rubbing against that urethra on the outside can give you symptoms as if it was coming from inside the bladder. So if we can even fix the outside, you won't get those symptoms anymore on the inside.
That's right. That's right. And, and these women are really suffering, to the point where they can't wear underwear, or pants are uncomfortable, and it really is disruptive to their life, not just their intimate life, but their just life in general, right? It hurts to even wipe. They're bleeding when they wipe after voiding or peeing in the toilet, it's unnecessary.
And often, because they're not sure what's going on, they don't even mention it to their doctor. And the doctor doesn't even know to ask. Like, I didn't know before a few years ago that I should be following up with all my young women who are on the birth control pill, asking if they're having genitourinary symptoms.
Or breastfeeding women,
or
right?
breastfeeding women. Exactly. Yeah. So you have to know, and your doctor has to know. And at the moment, we're in a situation where nobody knows, basically. So
Or
it's
these
a lot of women suffering.
Yeah. And they stop having intimacy with their partners, and then their partner is, pissed off, and then their relationship is failing, or they're getting a divorce. And this is legit what happens, you guys. Like, we're not being, this is truth. This happens. Like, they get their relationships fail because they stop being intimate, because their female partner is having pain, and then they just stop because they don't know why, and they don't know it can be fixed.
Right. And, when your ovaries are, at full tilt production, the vaginal walls are really elastic. There's lots of fluid secreted during intercourse. And when with less estrogen, then that elasticity decreases. And that's where a lot of women will have pain, or feel like, well, gosh, we fit together just fine until now. Or at the fourchette, which is the opening of the vagina, you get a lot of women will get those micro micro tears, and those things hurt when you just feel like, I mean, it reminds me of when you're trying to push a baby out and the baby's crowning, and oh my goodness, that's like the worst pain. You don't want to push through that feels good when you finally do. Well, now we got it coming in instead of going out.
Yeah.
Yeah.
Yeah, exactly. Exactly. And, they don't really understand that. That's why, these women are just like, I keep getting UTIs. I hear it. I'm sure we hear it all the time. And we're just like, someone needs to look at you. No, the cultures are negative. This is not it. And, there are changes in that microbiome, the pH changes.
Yeah, let's talk about that, Rebbecca. Let's start at the beginning. And so your estrogen drops.
Yeah. So you're right. The estrogen completely drops. And so that causes changes in that natural microbiome, right? So we have bacteria, good bacteria, and we have good yeast, and it's at this balance, right? And so anything can get it off. And then you have an overabundance of either, bacteria or yeast. And, we have a pH. Does anyone have the numbers offhand? Because I can't recall the numbers.
More than 6.
Brain.
Well, when it's a problem, it's more than 6.5.
Yes. So we go more basic.
You want it lower. Yeah.
That's right. We want that pH lower. And so that, as that estrogen declines, we have more of a basic, what's the word? Environment in the vagina. Yeah.
Yeah.
And
so as we lose our estrogen, we lose so much of the collagen and elastin in the skin, right? Even the skin of the vagina and the vulva. And that has a massive effect on the cells down there. They get thinner and the blood supply is not as good. And so now you're dealing with thin tissue that doesn't have a good blood supply, doesn't have a lot of collagen and elastin. And those epithelial cells that line it are supposed to make tons of glycogen, which is the food for our microbiome. And so when they're not making any glycogen, our microbiome doesn't have any food and it dies off. And so that's this whole ripple effect. And actually, we need testosterone too down around our pelvis, right? It's not just estrogen. Yeah.
I always say we lose that cushion, or when I use the analogy to my patients, I say we want to keep it like a grape and less like a raisin, because that is literally what happens, right?
It's all about,
and they're like, water content. Oh, okay, that makes sense.
Right. And when I, was, in charge of the emergency room, we'd always see sitting in the ER are those 70 and 80-year-old women who would come in and their families would say, she's confused, she's not acting right, things are changing in her behavior or her cognition. And 95% of the time, it was a bladder infection that ascended into the bloodstream and caused urosepsis. And we know that using preventative measures, whether it's systemic therapy, and also I think we all concur you need both systemic and vaginal therapies, but reduces the risk of UTIs by 50%. So this is addressing this as part of the nursing home prevention plan.
Right.
It's like, when
saving
you're baby and you have, diaper cream, we have an aunt in a nursing home who keeps having UTIs. She really needs vaginal estrogen to be applied to her every day for that prevention, like a diaper cream.
Yep. Not like we were saying, in the business of medicine, that also saves Medicare a ton of money, right?
It's like $6 to $22 billion.
Yeah. I mean, it's like an insane amount of money here. So let's just for a tube
of what, $10 cream?
Yeah. I mean, come on, guys. Let's get with the times on that.
Dr. Rachel Rubin and her crew did that study, right, where they looked at the numbers.
Yep. And then the guidelines just came out this year, right?
Yeah.
If every guidelines.
Medicare-aged woman, let's just talk about Medicare-aged women, was given their vaginal estrogen, we would save billions and billions of dollars per year.
Yep.
I mean, it's a nursing home prevention element, but also intensive care unit prevention element, right? Like when you have a patient,
recurrent ER visits.
Yeah, like you see elderly women who are in the hospital being treated for a pneumonia, and they're getting better, and they're on their way out, and the next thing they spike a fever and they're delirious, and now we know, Jesus, now they're after getting a urinary tract infection. And so they end up in the intensive care unit. And for anyone listening who hasn't watched the FDA YouTube
with the menopause
2-hour
panel.
long FDA
watch it in
panel
1.5, it won't be as long.
1.5, exactly. Speed it up. But like Dr. Rachel Rubin again told the story about her mom in the intensive care unit and how, you know, her having vaginal estrogen would have made such a massive difference, and she had to fight for that, and that shouldn't be the case.
Yep.
Right. Yep. Well, at least now in the hospitals, the catheter associated urinary tract infection is such a, you know, big discussion point too, is, you know, not putting in catheters, because even in the intensive care unit, there's very few times where they actually need to have a catheter. There's other things as well.
Let's also talk about the decrease in reimbursement when you have a readmission. So, you know, that's like, let's talk about the insurance-based model. You get hit for things like, you know, hospital-acquired pneumonia or UTIs or readmission rates and things like that. So those are all preventable things that it's so easy and it's so inexpensive, you know, and I think for the clinician, I was gonna say for the clinicians on here, make sure you're asking. Ask. They may not bring it up. And for the women that are listening to this, make sure that you're telling them, bring it up. You may be re-educating your clinician, and, you know, that's fine. They can go look it up. But I think either way, you know, we have to start talking about these things. So
can I say one more thing before treatment?
Yeah.
Just, I think in medicine at the moment, we have led women and doctors to believe that when we stop doing pap smears at age 65, that no one needs to look at your vulva or your vagina again for the rest of your life.
Wrong.
And unfortunately, for a lot of women, they're okay until age 65. And that's when the genitourinary syndrome hits them. And they won't mention it to their doctor, and their doctor's not asking, and their doctor's not looking. So I think we need to really bring that to light as well, that yes, okay, you don't need PAPs after 65, fine. You still need someone to look at your tissues every year and talk about them and make sure that you don't need any treatment, because the chances are you do. I barely even know any women in their 40s who don't need vaginal estrogen. Right. They're less at 65.
That's right. And sometimes they don't realize they need it until they try it. And then they're like, I didn't really realize I needed it.
So many patients who said, "Oh, I've no problems," and then they use it, and they're like, "Oh, wow, okay, I didn't know I could have my 30-year-old vagina back." Yeah.
Mm-hmm. So, well, we brought toys. Not the kind of toys you're thinking of, but we brought toys to show you.
I know. So I get asked a lot by women, you know, if they're already on systemic therapy, do they need to add therapy vaginally? You know, the systemic therapy is FDA approved for the prevention of genitourinary syndrome, of menopause and all other lifetimes. But it's just frankly not enough. The tissue, everything from the pubic bone to the tailbone, needs to see direct application. It's just like, you know, putting lotion on your legs or moisturizer to your face. The tissue needs to see it, and and it works where you put it. And the what we use inside for the vulva, the vagina, and the bladder is not systemically absorbed. So I think
unless you have that,
for people to know. Unless you have that one.
We'll talk about that.
Yeah, let's talk about treatments, will we?
Yeah. You want to start with this since I have it here?
Yeah.
Sure.
All right, cool. So this is the Fen ring. This is really great because this is one of these systemic treatments, so head to toe, that you actually insert vaginally. So, you know, it's going to go in and it's going to like sit in here, you know, however your vagina is. So it molds around it, right? Just like that.
Like the birth control ring, but
correct, like the Nuva ring.
The next phase.
But not, exactly. There is
sits
one
up around the cervix.
That's right. Right, exactly. There is, and so it kind of like sits up like this. There is one that's called the E string that is not systemic, that just is for GSM. And this one is the Fem ring. This one is systemic. So it hits two birds with one stone, but it is expensive. Although you can get it through some insurance companies. I think military covers it, right, Christine?
Yep. The military will cover it.
Transition pharmacy, it's pretty reasonable.
How much is transition pharmacy
180
for?
for 3 months.
180.
Okay, so one
Yeah.
ring lasts 3 months and it's
Yeah.
180. Okay,
Yep.
all out of pocket, right? Or is
Yeah.
that
Yeah.
just the discount that they
Yep.
give you?
Yep, that's a discount they give you. It's you pay cash for it, or your HSA or FSA you could use too. I think that's what I use.
Yes, it costs you $180 out of pocket.
Yes.
What
out of
does it
pocket.
cost if you were to use like the Good RX app if insurance didn't cover it? What have you guys seen?
$600.
600 for you? I haven't seen it because I've been going with
to
Transition
$800.
Harmony.
Mm.
So what I will say with this is, and I didn't realize this because I kind of got slacky on my external vaginal estrogen here.
Mm-hmm.
I was like, oh, maybe I don't need this. So internal was all fine. But I will tell a story when I'm getting ready and, our spouses like to come and try and fondle in any way that they can. And I was like, ow, that hurts. Stop it. And I was dry. Like, I just didn't realize that was not comfortable at all.
Yeah.
And so I thought, shit, I got to keep using my vaginal estrogen. So that for me was not enough for the vulva and introitus. That was still
you still had to apply
ouchy.
some
Yeah.
externally. Yeah.
Yep.
Wow, that Femring in Northern Virginia is $875.59 through the Good
So
RX
ridiculous.
app.
So ridiculous.
It's crazy. It is great. It is a set it and forget it. It can be a little stimulatory to your partner. Never
thought about it.
Yeah, because sometimes they'll hit that ring and that can be more stimulating for them. If it falls out, you wash it off, put it back in, those types of things. So pretty easy peasy. I would say it doesn't last a full 3 months, probably about 2 weeks before it's being done. But if you have like some extra patches or gel, or you can just get your ring early and put it in.
And so it doesn't quite last the 90 days for some women.
Yep.
I think a lot of women are afraid of the rings because they're afraid it's going to get lost. What do you say to patients about that?
Well, it definitely can't get lost because it only goes so far, and then you're hitting a cervix or you're hitting a pouch if you've had a hysterectomy with that and they've taken the cervix. So just like here, you guys, right? So it sits in the vagina here. Your cervix is here. It is not a wide enough opening that it goes anywhere. So you may not be able to like get your finger in there to pull it out. Some people will tie like a little dental floss to that before they put it in.
Minted or plain?
Yeah, I guess whatever you would like.
For your pleasure.
I
guess you'd smell good.
Then.
Minty fresh.
That's right. Or it might tingle and burn a little bit. What about the kind that has a cinnamon?
I guess there's only one way to find out, girls.
That just made me tingle a little bit. Okay.
I think, Rebbecca, you need to try it out. I want to know if you can smell mint or cinnamon.
I mean, I must have long enough fingers that is fine.
I think you should do this.
You can smell it.
You should do this for our patients and our listeners. You should do it and tell us.
Yes, please.
Some do tie a little dental floss to it, so that way when they put it in like a tampon, then they can actually find. It's easier to just find the string if you don't have the dexterity, or you do have short fingers because your vaginal canal is, unique to you. Not everyone has the same length of a canal, so.
Feeling off in midlife? I'm Dr. Rebbecca Hertel, and I offer concierge telemedicine across multiple states focused on hormones, weight, libido, and sleep, and longevity. Let's get you thriving. So visit www.osteopathicmidlifehealth.com.
That's a great pro tip.
I'll talk about the cream.
Yeah.
So the vaginal estrogen cream, it comes in two different options. So you've got estradiol or Premarin. Premarin is usually very expensive because it is brand name, and estrace or estradiol is generic. So in general, it's cheaper to get the estradiol. The best way I know how to get it for people who have to pay for, a big copay is to go through Mark Cuban's Cost Plus website, where they sell it for about $13 with a $5 shipping. So I've had patients who were asked for $200 for that tube of cream as a copay at their pharmacy. And I tell them ahead of time, if you get anything crazy like that, tell me and I will send it to Cost Plus. Yeah. And I think with the Good RX coupon as well, it's cheaper. But I think Mark Cuban's probably the best place that I have found it.
Yeah.
So we tend to give you a little bit of a loading dose with the vaginal estrogen cream because for a lot of women, they're very low on their hormones down there and they need a little boost to get them up and running. And then you can cut down on the dose. So I tend to do it every night for 2 weeks. I've tried all different ways, and I tend to now just even use 1 gram of the cream, but you can use 1 gram, 2 grams of cream every night for 2 weeks. For a lot of my patients, I'll say you can get rid of the applicator if you want, because unlike any product you would ever have for a man, they give you 1 applicator and you're supposed to wash it and reuse it over and over and over. And I tried washing that thing. That has crevices.
Yes.
It's oily. You can't get the cream out of it.
And if you plunge it on accident, then it's on the floor.
I know. I know.
I think the only way it probably would come clean is in the dishwasher, but I don't know what your family might think about that.
Well, I have said to patients in the past, those of them who really want to use the applicator, I say just buy a bag on Amazon. Buy a bag of them. Exactly. It's like buying a pack of tampons, right? It's all going in the trash. I'm not happy about it. I wish it didn't have to be like that. But if you want to use the applicator, you can do that. Or you can get rid of the applicator. The first time, draw it up in the applicator. You screw the applicator onto the tube and then you press on the tube and the cream goes up the applicator. The applicator is marked 1, 2, 3, 4. Those are grams. And you want to go up to 1 gram or 2 gram or whatever your doctor has prescribed. And then you can just push that out onto your finger, right? The first time. And you're probably going to get cream from the tip of your finger to the knuckle, maybe. And then you'll know that's 1 gram if you've pulled up 1 gram. Or to the second knuckle could be 2 grams. But you'll get an idea of what's normal. And then you can get rid of the applicator. You don't need to use it. You can put that cream into the vagina yourself with your finger. That's funny. She just fucked her applicator out into the universe.
I can't see her.
I feel like I'm giving the instructions on the airplane. You know, mask comes out. Lower
your mask first. Put it on your vulva first.
Rebbecca is doing. Oh, I hope anyone who's listening will switch to YouTube instead.
You gotta watch YouTube. So funny. I told you we brought fun things today.
She's doing all the action.
All kinds of stories.
All right, get your vulva out then, because I'm going to teach how to do it. So get your cream on your finger and take put it on the back of your other hand, take half of it and put your finger into the vagina and sweep it around in there and get it onto the walls. You're thinking of it like a moisturizer, like your facial moisturizer.
Even do a little pelvic
then get the rest of the cream off the back of your hand and let's do all the outside of the vulva. You want to make sure you get the clitoris and the hood of the clitoris. The urethral opening is just below that. That's really important because a lot of your symptoms could be coming from there. And then we're going to do the opening of the vagina, and especially round to the back part. And then those smaller lips, the labia minora, they're the ones that don't have any hair on them usually. And you're thinking of it again like a moisturizer. You're rubbing it in. You don't have to use a ton of cream. And there's your treatment done. And you do that every night. Oh, you can do Sometimes
they have itching right around that perineum and rectum. I tell them to put a little vaginal estrogen there. And they're like, because they always think it's hemorrhoids. Well, sometimes it is, but
yeah, you're right. You're right. I've actually had patients tell me their hemorrhoids get better when they start using the vaginal estrogen.
You that said that before. I was trying to remember that the other day.
Yeah, it does. And you can see why.
I may not have tried it myself.
They're a soft tissue. There's collagen in there, elastin in those tissues. And so when it disappears, they just flop out. So then when you've done that for 2 weeks, you can cut back to twice a week or 3 times a week. And you should be able to sustain those results. Usually within 8 weeks, you have your normal tissues back, I would say. Would you agree, girls?
Yeah. And I'll tell you too, that there are a couple of different ways. So I started off with every day for 2 weeks. What I did notice is some of my patients would often get a yeast infection. So I cut down to just doing it just one way, but both ways are completely fine for patients. So, but I know some of you will listen to this and be like, oh, my doctor only has me do it twice a week. We never did a loading dose. So some
That's
physicians
fine.
and clinicians use the loading dose and some don't, and it's not wrong either way. So
Yeah.
I just find it works better with a load, but I tell patients do it as 7 is really, I tell them 7 days is non-negotiable if you want to get it fixed.
quick.
And then, but if you're going to throw the whole thing in the garbage and never use it again, then,
Use
you
it.
know, at the 7 days, then transition to the twice weekly.
Yep.
You know, I had, you know, I had kind of guesstimated where a gram was on my own finger.
Yeah.
And then I one day did it and I was like, oh, I had been cutting myself short. I was only using a half a gram.
You
I was
got
like, no
small
wonder
fingers?
it wasn't working. So measure your finger. Measure
Yeah,
it.
and you can even pull it out, like we said. Here, pull it out and then put it right on here and see, because that's 1 gram here. So if you don't want to use it, but you want to know for sure, it's a way to do it.
Yeah. Or pull the
Oh,
cream
yeah.
up into the
Turn it the other way.
applicator.
Yep.
And
You
then
guys
push
don't
it
have
out onto your finger.
Was.
And you don't have to be like, oh my gosh, I forgot it. Okay, so you forgot it. Use it the next day. Or if you're going to be intimate, listen, we want you to have fun. Use it after, use it the next day, you know, or change it with your patch if you're using the patch. So it's, you know, the best way to use it is to use it.
Yeah.
Correct.
And it's fine to be intimate having used your cream anyway. You
Yep.
know, the chances are if you're a postmenopausal woman, your partner's, if it's a male partner, their estrogen's higher than your estrogen anyway. So a little bit extra is not going to make any difference. There's, when I say micro amounts of estrogen in this cream, I really mean micro.
Yep.
We did the math on it, didn't we, girls? If you do the cream as you're prescribed for 1 year, so you've done your 2 weeks, you've done twice a week or 3 times a week for 1 year, there's as much estrogen in there as there is in between 1 and 2 birth control pills that we give women every single day. Not 1 to 2 packets, 1 to 2 pills. Yep. That's how little estrogen there is in these products. Don't be scared of them. Lash them on.
Yeah.
And if I get asked often, you know, what if we have sex? Can I then do it? Sure. It may be a little messier with semen coming out, but that's fine.
Assuming that it was deposited. Sometimes people don't like to deposit semen.
That's true. If they deposit,
if
you have a deposit. I, you know, was not using my vaginal estrogen. I didn't like it. And again, because I realized I was underdosing myself of what I thought was a gram, but I just didn't like it. I already have testosterone gel and Divi gel. I'm like, oh my gosh, I'm wet all over my legs, right? Until all that crap dries and is not sticky. So I wanted to try this VagiFem, which I never recommend starting with it because I don't find that when you start with it and you're dry and things aren't elastic, that it works very well. And when I was in GYN clinic, women would come in and I could see all their tablets kind of backed up in there. But I love this. I know it's not great for the environment. Little plastic tube, much smaller than even a small tampon. And then you just click and it's this tiny, tiny little tablet. I can actually feel that tablet melting in my vagina. Like it feels a little like, I don't know, it feels a little activating. I don't know if it bubbles or what happens when it hits there, but it feels cool, kind of menthol-y when it first.
That's like your floss?
Maybe like that floss
effervescent.
Effervescent. Yes. That's what I'm imagining.
What's happening to Christine? Oh, don't worry. It's just her VagiFem.
Christine looks so happy. What the hell is going on?
Yeah. Don't worry about her.
The only thing better would be that vibrator. But yeah, so I like this. I've been very happy with this.
Okay.
Yeah. And then there's a little suppository type. The Imvexi.
Or Imvexi.
Imvexi.
Yeah, this is Uvifem.
And the Intrarosa.
Yeah. So the Uvifem is the tablet. And then we have a kind of softer suppository as well, which is a similar thing. and you use it every night, and then for 2 weeks, and then twice or 3 times a week forever.
Forever.
Forever. What else are we missing? So we've done the tablet, the insert,
Intrarosa,
Femring, Estring. Yeah, Intrarosa.
DHEA. So that breaks down. So that's a DHEA suppository that you insert, and that breaks down into estrogen and testosterone. So if we're not compounding an estradiol testosterone cream for the vulva, sometimes Intrarosa we'll start with perhaps first. The problem with that is expensive and not typically covered.
Mm-hmm.
So
there's poor man's Intrarosa.
Yeah.
There are dissolvable DHEA tablets, 5 milligrams. There is a particular company, I think it's Douglas Labs. I'm going to go look it up. And you can just pop that into your vagina. It is Douglas Labs. That was Dr. Irwin Goldstein's
Was it 5 or 10 milligrams?
Huh?
Was it 5 or 10?
5 milligrams. And so that was his recommendation, sort of the poor man's Intrarosa. Mm-hmm. The people don't like that Intrarosa a lot because it's really oily, and the DHEA tablets are not.
Yeah, they're leaky.
But non-estrogen, and breaks down. There's androgens, which you have a lot of androgens, like testosterone-like substance androgens. And so I think that that can be really helpful for people who have blunted orgasm, or just, all the estrogen only products are not working. And then there's, that's usually my next go-to is Intrarosa or DHEA tablets.
Yep.
It's very difficult to get Intrarosa covered.
Yep.
The one that I use with myself and my patients who can't get it covered comes from a company called Bezwecken. Bezwecken, I think. And it's a little suppository. Oh, you have them, Christine? Yeah, a little suppository with like shea butter and olive oil, maybe. They're tiny.
Wait, can't see it. Go over.
There it is. Yeah.
There it is.
They look like
a little bar of soap.
Little bar of soap.
That's from this Bezwecken place?
Yeah, they're so good. I find them fabulous.
Hydrating.
And they have DHEA in them and shea butter and maybe coconut oil or something, but really natural. Now they're about $25 a month.
Okay.
It's
better than Intrarosa.
But that's, you can, there's different, they partner with different clinicians. And so if you just Google them, you should be able to compare prices and find the cheapest one for you.
I think they're cheaper on Amazon. I know at the GYN office, they bought them and then they marked them up. They were cheaper.
Yes. Okay. Good to know. That's good to know. I had contacted them to see, could I just buy some for myself?
Yeah.
And they sent me their whole contract thing to sign up with them. I didn't do it because I don't have a physical office to sell them.
Oh.
But yes, you can mark it up if you want to. So that's what I mean. Like, hunt around and find the best price. But DHEA can be life-changing.
There's extra strength and 2+ DHEA.
If you find you're doing your vaginal estrogen and things are not improving, it means that you need some DHEA or testosterone down in the pelvis, and you must get that or things are not going to improve.
Yep.
And then there's the aspemethine, which I have trouble saying that word. It's a selective estrogen receptor modulator. It's a SERM. I always refer to those as like the designer estrogens. It's good for vaginal pain with dryness. It acts like estrogen in the vaginal tissue, but opposes estrogen in other tissues. The only issue with that aspemethine is that you cannot combine it with estrogen due to risk of blood clots. So it's a solo only. It doesn't stimulate the breast tissue. It doesn't stimulate the endometrial tissue. But for women who are not using systemic therapy, it's a good option. It's once a day, daily pill, and women, I've had patients on it and they said it works like a champ.
It's an oral tablet, right?
An oral tablet. Yeah. Oral.
Yeah.
Yeah. Well, what about the box warning? What about the package inserts? Who wants to tackle the package insert?
Geez.
So that's what that
Crumple
FDA
it up and
meeting.
throw it away.
That's what that FDA meeting was about, that we want everyone listening today to go and watch, please. Because back after the Women's Health Initiative study, when they, unfortunately told the world that estrogen could cause these horrific symptoms and problems in women, every estrogen product after that got labeled with the same warning. So even this vaginal estrogen, which I would compare to the 1% hydrocortisone that you put on a little bit of dry skin and you get over the counter, compared to IV Solumedrol steroid that's injected into your vein when you go in anaphylaxis to the emergency room, that's the difference between the different types of estrogens we're talking about here. So there's no way that black box warning should be on the vaginal estrogen products. And that's what that whole FDA meeting was about, to try and convince the FDA to take that off, because it's a barrier to care. Women are scared. We all have patients, right? And we've talked to them about this. We've tackled it head on. We've said, take that insert and throw it in the trash. That's where it belongs. And they follow up and you say, so how are things going with your vaginal estrogen? And they say, I read the insert. I know you told me to throw it away, and I was too terrified to start the treatment.
It's terrible.
It's horrendous. If this was a male thing, and we saw what happened with testosterone, right? They did a quick study and then changed everything and said, actually, it is safe.
If they were told that their testicles were going to shrivel up and go away, like our labia minora do,
they'd be slathering it all up in there.
Yeah. Was that you that said, Christine, it would be in like, what do you call those machines where you can like put your money
vending
in
machine?
A vending machine?
Yes.
And it really should be over the counter. I mean, it's really ridiculous. Like, you should be able to get it everywhere. And, I think that the vaginal estrogen products are first line measures. And then if you want things like moisturizers, then knock yourself out. And so I'm going to segue us, right?
Yes. Otherwise we'll keep talking and this will be like 5 hours.
You'll hear providers say first line therapy is lubricant and moisturizer. No. First line therapy is vaginal estrogen products, and then complement what you need. All right. What do you got for moisturizers over there?
I got a little rosebud.
I'm going to get some of that.
It's expensive.
Yeah.
Oh, you got a baby bud.
Yes. And I thought this was because it looks like my lip whip, and the print is so small on it. I didn't know that it said, I didn't know what it said. I couldn't read the print.
Did it feel good?
It does work really lovely on my lips.
on both sets of lips.
But does the lip whip work really lovely on your vulva is the next question.
I don't know. We'll have to ask Carrie Gran. This is the Dulce Vita. I don't know as though that would smell very good on my vulva. Be a little bit.
This smells good. I love this.
On my vulva.
Smells good.
I'll ask my husband if he would like that.
If you can, it's really nice. See how nice and shiny?
Yes.
That is so nice. You could use it.
Oh, is that the Honor Bomb?
This one's the Rosebud.
Oh, that's Rosebud, another one.
So the Rosebud for 1.7 ounces, 90-day supply is $90 for a one-time purchase. And if you subscribe, you get 20% off, and it's $72. I am going to order some of this to see if it's good.
You don't need much. It's very good, and you don't need
issues.
much. Yeah, I clearly was having some issues too.
I've got another one. This is the first one that I had used, and I was looking, since you looked up the
price. This is scented, y'all. So if you don't like scented, then don't go with this.
How much is that Honor one?
Which one?
The Honor one. The Rosebud, sorry.
Oh, this one. It's $90.
The $90.
But it's so pretty.
Oh, it is pretty. Yeah, I like that. So I have another one. It's from Intimate Rose. It's called Enchanted Rose. I don't know. Can you guys see that?
Yeah.
It is wonderful as well. This was the first one that I've tried. And this is fantastic. Except now I can't turn on my computer or look up how much this one was. But it was $26.99 for this big tube, and I've had this for quite a while, but good for daily use.
Yeah.
I think moisturizers are great for daily use.
I put it on the rest of my body. We should probably put it on our vulva too.
Rebecca, is the scent from the rosebud nice?
It's very nice. It's like roses. It's very nice.
Right.
Yeah.
Oh, it is?
Yeah.
Like a stick. Well,
yeah, your nose in there.
Oh, it is rose. Duh. Anyway, it smells
lovely. PhD. I just started using this just because I was trying to sample them all out.
What's that one?
To like let you know, this one's from PhD. This one's unscented. So for those of you that don't, you can get it unscented. I thought this was pretty nice also. Maybe a little bit thicker than the rosebud.
Which might be nice for some people.
Exactly. But not super thick. It is not like a Desitin ointment, right? Or even Vaseline. That is nice. So these are moisturizers, you guys. Okay, these are just like, you are not necessarily using this with a partner. This is part of your daily routine. You're going to put this on, and then if you wear panties, put your panties on. So, you know.
I was saying that every time we go somewhere, someone gives us a bottle of lube. And I'm like, I am never going to have enough sex in my lifetime for the amount of lube that I have. It's just nothing. And I'm looking, this one expires in January of 2026.
Oh, you got some time.
Hurry up.
I know, but I haven't used enough. I'm going to tell my husband, because his colleagues are listening to the podcast. Tell him.
I love it. There's the inserts too, right? The vaginal inserts that are moisturizers too.
Oh yeah, the bona fide, the hyaluronic.
Hyaluronic. Hold on.
Yes.
Go ahead, Christine. I'll find them.
Hyaluronic acid is a wonderful moisturizer for the vagina.
Yeah, Bonafide has some really Reverie, right?
Reverie is one.
Yeah.
So you're finding it? Oh,
yeah. I've got just this one. You keep going.
Lubricant is for friction. This is for sex. This is what this is for. So this is Velvet Rose by Intimate Rose. I like this a lot. Stripes. This reminds me, it's Oh My Glide. This reminds me a little bit of baby oilish. And then the other one is Go Love. It's Intimate CBD Serum. So it has CBD, ultimate comfort, pure pleasure with a little bit of CBD, which is supposed to help with arousal. I don't think it did, but it's at least convenient to travel with.
And what you got, Aoife?
I have some Uber Lube here.
I think Uber Lube can be also a little moisturizing. I tell my patients that you can actually use it for lube and moisture. I think it's nice enough for both.
I love Uber Lube.
I do too.
Good, clean love. That's pretty much the main ones that people use, because there's nothing in them that's going to be irritating.
No, and it's pretty, guys. I mean, let's be real.
I know it's cute.
Like nice. When you like get this out, you're like,
when your kids are going through your drawer and it's like, what's up with the pretty lube, Mom?
See out my drawers. I tell my kids, if they're looking for something, I'm always like, if it's the nightstand, just beware of whatever you're going to find.
You don't know what you're going to find in there. Go in there at your own.
Enter at your own risk. You got it.
Okay, let's keep going. So,
is that it?
Well, lasers.
Mona Lisa.
Yeah.
They're expensive. They're like $2,600 for a main section, and you have to redo them annually.
And I did that V thing or Viv or Viv something.
I know.
Where you sit on the ball and vibrate.
I think
it was like a laser thing. It was like a vaginal facelift. It didn't last for that long, but
yeah. I think there's two reasons why women turn to things like the lasers. A, they're worried about the safety of vaginal estrogen. B, they have tried vaginal estrogen products and have only improved to a certain extent.
Yep.
Maybe those are the women that no one offered them testosterone.
Yeah.
And so they're looking for something extra, or they don't want to use something 2-3 times a week, and they want something that will give them 6 months of a normal vagina and vulva, So I think people go looking for things for different reasons. And there's mixed evidence about the lasers, right? There's evidence that says they don't work at all. And then there's some evidence that says they can be helpful. So I think it's a real personal thing for you. If you want to try it, it's available, but it's expensive.
Are you guys finding that patients, because they want better absorption and because they hear us talk about compounded estradiol and testosterone creams that we do give to patients, are using their testosterone gel?
I'll tell you what I do.
In their vulva?
I'll tell you what I do.
Can't wait.
Funny that you said that,
guilty.
because I was just about to be like, should I talk about what I do? So I put my testosterone every day on, whether it be lateral thigh or up here, and whatever is left on my hand, that is the hand that I use for my vaginal estrogen.
That's what I do.
Oh, good.
That's what I do too.
Yeah, because I'm like, it's not very much, but I think it's just enough. And if I were, obviously I need to start using all of that again, but yeah, it just made sense to me. I'm like, well, I still have a little bit on my hand. I'm not gonna wash my hand, because then I'll put that vaginal estrogen on, rub it all in between those fingers that I use, and then apply.
Yeah.
I have patients.
If it directly, it would be irritating with the
alcohol based. I think so.
Possibly.
Yeah, that's one reason why I haven't done it directly. I think could you maybe do like a quarter of a drop or whatever, or like, put your 1 or 2 drops on your shoulder or your leg and then have a little bit more. Yeah, you could probably play around with that and see.
But I get patients who come and they have been using the full dose. They're usually on the compounded cream, the full dose, applying it to the labia and the vulva. And I definitely warn them that you are somebody then who could really develop clitoromegaly, enlargement of the clitoris if you're doing that every day.
On there. Yes.
And, you're not going to wake up one morning with a 2-inch clitoris. No. It's going to be a gradual process. So if you're putting it on every day and you notice that your clitoris is getting bigger, then you have to stop, right?
You have to stop. That is irreversible.
You've got to start putting it on your thigh or your delt or somewhere. Yes.
Are you finding that you're getting high testosterone levels with them putting it on there? That's what I hear people on social media. That's why they're doing it.
Yeah, I haven't tested, to be honest, haven't tested enough, because I don't tell them to do that. I don't even tell them the way that I do it. But I can tell you that my levels aren't crazy for sure. I hover anywhere between 50 and 70. That's where I feel good. Closer to 70, sometimes I break out, so I go back down a little bit. So I'm really sensitive to the androgen itself, and that's like 1 drop. That's all I use.
It's tiny.
That's good.
Mm-hmm.
Yeah.
Mm-hmm.
And then pelvic floor physical therapy is our last kind of measure to help with all these. Our pelvic floor physical therapists, we do not have enough of them. They are absolute angels that fall from heaven, and they're like little unicorns, and we love them so much, and we need more. And women need to know that they exist too.
Yes. They're wonderful. And that is a great adjunct. And I don't think that's an either or an or. I know I get patient referrals from pelvic floor physical therapists, which thank you. Because they will notice it first and then be like, where can you get yourself some vaginal estrogen? And then nobody's giving it to them. Right. So
I've gotten referrals from PT. Where the patient goes, my therapist says I've progressed to this point and I can't get better unless I have vaginal estrogen.
You got it. It is such a great collaboration with clinicians in that space, and vice versa, right? We're just like, we can only do so much. You need some pelvic floor, or let's see if it works, in addition to, evolve our specialist if needed, if we're not the ones. Obviously, our telemedicine practices, we cannot see your vulva. So
don't send us photos.
Don't send Yeah. Well, I guess you could upload it to the EMR. I mean,
I'm just kidding.
But and the problem is then finding someone who actually knows what they're doing and what they're looking at and how to examine it properly, and the Q-tip test and all that. So, but those are things that your menopause specialist will talk to you about and tell you who to look for and what to look for and the questions to ask.
Right. So. And symptoms definitely do not get better with time. And even though you may feel uncomfortable, bringing it up, I know it's in my screening question. So I always bring it up. Yep. It's something that, we want to talk about it. I mean, most of my patients first visit, they're leaving with vaginal estrogen, the vast majority of them. Yep. So just ask for it. Everybody can have it. Lots of it.
Yeah. And that black box label warning, when you open the package and you take out this massive piece of paper that unfolds and it says, if you use this cream, you might get breast cancer, heart attacks, strokes, probable dementia. That's all bullshit. You can tear it up, you can throw it in the trash, you can do whatever you want with it. That does not apply to your vaginal estrogen cream.
I think you should hand it back to the pharmacist.
Yeah.
Take it out and hand it back.
Yeah.
Here, I don't need it.
And I think the key takeaway from today is talk to your doc. Bring this up with your doctor.
Yep.
Yep.
I love it. All right. That's why we're here. We're breaking the silence one muffin at a time.
That's right.
One dusty muffin. It's taken us this long to get to it, but we're here. You've got 3 dusty muffins talking about dusty muffins.
That's right. Trying to prevent you all from having dusty muffins.
Yes.
So that's, that's it. And
you
guys remember when you listen to us, make sure that you like, subscribe, leave us a review. We really appreciate it. Follow us on all the platforms, YouTube, if you want to see all the fun stuff we had today. And if you guys have questions and topics that you want us to cover, give us an email or DM us as well. We'd love to go over that kind of stuff too. So we, we'll make sure that we get some podcasts on whatever y'all are thinking about, talking about, or wanting to hear us talk about.
Yeah. What's our email? DustyMuffins333@gmail.com. Is that right?
Yep, exactly. And leave a comment on the YouTube, under the YouTube video. Leave comments. We love answering comments.
Yes. So, all right, you guys.
Thanks, ladies. Always a good time.
Always. Bye-bye.
Bye, Dusty Muffins.
Bye.